Well, we've got some highs and we've got some lows. The low is really low and the high was really high. Let's start with the good and get to the bad. So I had my hematology appointment. It went absolutely amazing. He had a student with him, and the student was able to learn about EDS. He was able to learn about mast cell. And I'm getting my iron infusions. We're getting those done. Actually, here at the end of September, I will be having my infusion done in 2 parts. I'm getting my first one September 28th, and then I'll have it done in a week later, 2 weeks later. We have to do it in 2 parts and do it really slow because I could go into anaphylactic shock because of it, and they are doing pre-meds to be safe, but still it's a risk, but we have to do it because my iron and my ferritin level is so low. The cause of the ferritin level, sort of embarrassing, but the cause of my ferritin level is because of my menstrual cycle, which I have been ignoring and pushing off for 10 years now, maybe even longer. I knew it hasn't been normal. My girlfriends told me to go in to the gynecologist. My mom, my sister, everyone's been telling me this isn't normal, but my mom had horrible ones, and so I just thought, if my mom had a problem, whatever. I am losing so much blood. The input to output rate is, I cannot restore my stock of iron and ferritin. So basically, I'm getting an iron infusion, and then in 3 months, they're going to check my level, and if I need it again, we'll do it again. But the problem is that's only a patch. What we'll have to do is now I have to get a OBGYN referral to go see how we're going to fix this problem. For me, I do not want to be on a pill. I do not want to be messing with hormones and then messing up something else, because who knows if I am allergic to those things as well. So yeah, the meeting went really well with him. He explained things very detailed. He let his med student was curious about me. The doctor also was like, I let the med student talk to you because I need my med student to understand that people like you need to be heard. And when he said that, it was so validating. He also went through and talked through the science of things, not only for the med student, but he also saw that for me, I wanted to hear these things and understand these things, which was very validating as well. This doctor understood that I wanted to know the research behind it, wanted to have choices and decisions, wanted to be a part of the decision making, and wanted to hear what was happening, not just be like, here, I'm pushing you into this. Once I understand what kind of infusions I'm getting, I will start talking about what kind of infusion it is, but it's being done in a 2-part thing. For my ferritin level and my iron. My hemoglobin's fine. It's just the iron and the ferritin. You can see more about that in my Caring Bridge. From there, I have not gotten my OBGYN referral yet, but I have recommended, once I get the phone call, I have 2 people in that system who are recommended from my complex care doctor who understands my disorders already, which we need that because I learned my lesson yesterday. Having a doctor who doesn't understand my disorders leads to bigger problems. So we went from this super high, having a great hematology appointment, which he was like, we're going to do this and this and this and this, and here you have a care team and you've got this and this and this, and have all of these options. He also was like, I understand your mast cell, so here, have this med as well, and if you have these problems and blah, 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 blah. Then the next day, since I've been off my meds, I went off my meds. By the last day, I was in a lot of pain, but I actually managed pretty well. I didn't end up filming it because it wasn't as crazy as I thought. It is on my TikTok, though. If you want to see my TikTok or my Instagram, it is TANZ Chelsea, CHELSEA, same as my Instagram and my TikTok. But you can see some of my kookiness on my TikTok. I did not sleep for 2 days while I was off the meds for my EMG. But the problem was, is I contacted this doctor 3 weeks before my EMG to let him know about a protocol that was done for stiff person syndrome that Johns Hopkins does, and Johns Hopkins is the only place in the world that has a clinic for stiff person syndrome, and their protocol is the protocol for stiff person syndrome and EMG, and he dismissed it. I feel like I was not heard. Anyway, I went in. My goal was to talk to him before to present some information I had, show him the videos, show him how I progressed. But when I went in, he sent me in and I didn't get to talk to him. I was sent into the EMG and was laid down on the bed, and a tech was there doing these things, and I said, I don't feel good because I'm nauseous. She's like, why are you nauseous? I said, because I'm off my meds, and she goes, is that normal? And in my head I go, why doesn't his assistant understand that normally you stop taking your meds before an EMG? Like, this is the dumbest question I've ever heard from a person. Like, okay, I'm gonna ignore this. That gave me a bad feeling. Then Mom left. We did that part. Then Dr. Kelkar came in. Minneapolis Clinic of Neurology is absolutely horrible. He came in, and I still wasn't in a stiff state. I was stiff when I first came in when I had to move, which was difficult, but I managed to get my legs and arms to calm down. But then once he poked me in my arm a couple times, he poked me in my legs, and once he started poking in the leg, then I went stiff. My arms went straight up in the air, legs started to go and twitch like this, and then my back stiffened up, so I was sort of stuck like a bug up in the air. Then he told me to roll over, and I said I couldn't, and he said, why? And I had my headphones on and my darkest glasses, so I couldn't really hear things while he was talking, while his tech was in there. And a couple minutes later, he says, roll over. And I told him I couldn't because I'm stiff like a bug, just like a dead bug up in the air. And yeah, so basically he was not understanding what was happening with this stiff person problem. And so I said, you're going to need to help me. So he sort of pushes me over, gets me in my back, and sticks the EMG in my back. And does that, then rolls me over. Then he tries and says, okay, sit up, you're done. And I say, I can't. I have my stiff collar on. He tries to pick me up by my neck collar. Like, my whole body is stiff. You can't sit me up. My whole body is stiff. If you've seen the videos, you cannot move me. You can't sit me up. You're stuck in the position that I am in. Tries to pick me up by my neck collar and says, okay, get in your seat now. And I'm realizing in my head he has no idea what he's dealing with at this point. Trying to get me to just sit up and get in my chair. Like, get up, go in your chair now. I tell them to go get my mom. My mom comes in, and I'm like, Mom, he's trying to tell me to get up and get in my chair. And then my mom starts to get very frustrated, and I'm like, and she goes, she can't. Look at her. And he goes, well, the results are negative. And now what I'm finding out about EMGs is that they're sort of read to an interpretation type thing, and there's some loopholes in how you read it, which I found out the night before, and also found out that he went digging into my chart and found the old label that I removed, FND. And he said, I think it's, I don't think it's a neurological thing. This isn't neurological. This is psychological. Well, it's part of your brain either way. FND, functional neurological disorder. That's neurology. It's in your brain. If that was the problem, but it's not, sir. I said, that label was removed, and I said, do not damn me with a scarlet letter. If you do not understand something, do not blame psychology, or do not put a scarlet letter on something, when you do not understand the condition. Just because it is a mystery does not mean it is psychological. It just means you do not understand something. And he goes, no, that's just what's in your chart. And I said, so is it in my chart, or is that what you're saying this is? Because those are two different things and both of them are bad. And I'm trying to tell you, I had a long conversation with Mayo and my primary and my complex care doctor, and they have all removed that label, and you were trying to throw that label on me. And what I am telling you is that is not what's happening here. They have removed the label because that it was the incorrect label, and I'm trying to figure out this problem. And you told me you were specialized in this, and now you're telling me no. And what I'm trying to tell you, and the facts I've been trying to give you, and the portal messages, and trying to contact you, and the phone calls you don't return, is that you can diagnose me on nothing, and all you have to diagnose me is based on symptoms. You can diagnose me. People can get diagnosed with negative results and a negative EMG, and if it can be a false EMG. False EMG because you don't go off your meds long enough, which I tried to warn you about 3 weeks ago, which you did not hear, and now we sit here right here. And I said, you can diagnose me based on symptoms in the videos I have showed you. He says, but I can't do that because I don't know stiff person. And the words fell out of his mouth, and I said, what the hell am I doing here then? He says, well, what are you doing here if you've already been to Mayo? Why don't you just go back to Mayo? And I was like, those words came out of his mouth, and I was like, might as well have just said, go back to hell where you came from. I was so mad, so pissed off. So things got a little heated, and I was just like, you do not understand what you just said. So you've tried to blame this on psych. You've tried to blame me that it's already in your chart. So basically you came in already with a preconceived notion, thinking this was going to be negative. So you knew it was, you knew basically that you were just going to label me with this. You have no idea what you're doing. Oh, I specialize in EMGs, but you don't specialize in the one thing that we're looking for, because you can't diagnose me based off of symptoms alone, but other people can who specialize in this. Why did you tell me that you were going in deeper than you could do? You should have just told me I can't help you and told me to leave and not waste the last month of me just sitting here waiting for a solid month to get in with you. Then he got mad and just sort of stormed out. While I'm still sitting here stuck with my arms up in the air, frozen, I'm having this whole conversation on my back, just frozen like this. Tears start to stream. My mom's upset. My mom's trying to get my meds in my mouth that I can finally take after like 36 hours of not taking my medications. I went longer than he asked. I went in between 3 days and the one day he wanted me to stop taking my meds. Just stop taking the meds the day before. I stopped taking them the day I missed one dose, and then the day before. So pissed. So I thought I had found the right guy, because the first day we met him, he was so compassionate and caring and understanding. He's like, oh my gosh, you need help. So I think he saw something. He's like, I just found I'm going to diagnose a 1 in a million. I'm going to go to my frat boys. I just found this crazy zebra girl. She's got all these issues. Look at this. And then he's like, I don't know what to do with this. Go back to Mayo. What do you even... Literally, he said, go back to Mayo. I don't know what to do with you. And then he stormed out, and I was like, nope, you're not going to storm out on me. You do not storm out on a patient when you do not know what to do with them after you try to stigmatize them. I will have the last word, sir, because what you just did is inappropriate and not okay. Not okay. So as my arms are still stuck out, I was able to get into my wheelchair. Mom rolled me around the corner. I said, Mom, knock on his door, because he shut his door. I said, Mom, knock on his door. She said, no, Mom, he's done. He walked away. I said, Mom, knock on his door. Knocked on his door. He tried to say, no, I have to put these things in and I have to do these things. I said, no, you need to listen. He said, I don't have to. I said, no, you need to listen. And Mom said, no, listen. I said, I went to me. I heard you. I said, no, listen. I had a long conversation with the Mayo doctor who misdiagnosed and messed up. And he said that it hurt to hear, but he was humbled by it. And you need to hear that. That misdiagnosis and all of those seizures that you want to put in here, pseudo seizures and all of this junk that you want to label me with or damn me with or scarlet letters. You neurologist needs to understand that mast cell activation syndrome can have and present with seizures. So step 1, stop damning people with psychological stigma because you don't understand it. Neurology needs to accept mast cell activation syndrome as a neurological condition. That's step 1. Step 2, a question mark does not equal psychology. If you do not know, say you do not know. Step 2, I need a referral to Johns Hopkins and Cleveland Clinic. Step 3, I'm sorry that I got mad, but you should have been up front. I got the referrals. I said, I'm sorry and thank you. But I'm going to keep fighting for stiff person. Because of everything I've seen and everything I know, this is a long journey I am about to fight. But there is nothing else like that looks like this. And I know it can be misdiagnosed as FND, fibromyalgia, agoraphobia, Parkinson's, MS, anxiety, and everything else you've tried to throw at me. But when I got to that support group, I finally felt at home. And when I put those videos up, I look identical. So could you please send those referrals out and not put that damning scarlet letter in that thing? Because I'm putting spasms, okay? Thank you. Opened my thing today and he activated the word pseudo seizure in there. It's been active since August, I guess. So he didn't put it in there. It's been active for some reason since August. So whoever, somewhere in that chart, it's been active in that group of doctors. I've seen a bunch of people in that Minneapolis Clinic of Neurology. I warn you, if you're from Minneapolis and you're having big neurological issues, do not go to that clinic. I've now heard from multiple people. It is absolutely horrible. Now I can tell you, those doctors, if you are having mystery problems, do not go there for your mystery problems. Migraines, yeah, you're fine. Go ahead. Basic issues, go for it. Mystery problems, nope. Nope. No. So I left. I thought I was going to get the diagnosis so I could start treatment so I wouldn't be bedbound. But here I am. I sent in my message for my favor to Mayo, and I got the reply, I don't see any notes, clinic notes from that doctor or labs. Could you send them, please? Then I talked to people from there, and they said you need a movement specialist, so I called my complex care doctor and asked for a referral to a movement specialist. So I'm going to go look at Naran for a movement specialist. I still might send down my stuff down to Mayo. Very hesitant because everything is negative currently. I don't know if I'm ready to go down there because that place is just, I don't know. I'm not done fighting. But this label, once there is a label put in your chart, it follows you. Even if it's been removed, what it does is they just sort of like cross it out and like addend it or whatever it's called. Like, here's the label. Be like, oh, it's changed? Okay, we're just going to put a red X through it. It doesn't like just disappear. They just put a red X through it. You can still see it. It doesn't disappear. So that scarlet letter will follow me for the rest of my life. If I were going in with chest pains, which I have, 180, A doctor came in and said, before he even met me, he came in and said, I've looked at your history. I think you're having white coat syndrome. Yeah, I think you're having some anxiety because the doctors are here. Which actually I'm with a cardiologist. He thinks I have POTS, which is related to my EDS. But because I have all of this scarlet letter stuff going on in my charts, even though I have legitimate health issues because of this scarlet letter following me around, when I go to ERs, when I go to hospitals, they will first choose the psychological option before anything else. Just today, I was reading something on another page, on the FND page. Somebody was in the hospital with pneumonia, and they said, it's because FND. I'm sorry, pneumonia is like bacteria. Your brain did not create pneumonia. Keep fighting psychological stigma. Do not let them stigmatize you. Advocate for yourself. Speak up. I just sent paperwork over to another hospital to addend my paperwork so they will remove stuff or just put an X through stuff to fight a doctor. I just spoke with an organization. That's from the other video. I can't wait to be healthy enough to go to, and for COVID to be done, so I can put on a fancy ass suit and fight for disability rights. And fight for rights that protect patients against stigmatizing crap that happens in the hospital, that just because you have a label, that doesn't bar you from services. And if you do have a mental illness, that doesn't matter. If you are physically having a problem, just because you have a mental illness does not mean you get treatment. Does it oh, okay, you have a mental illness? Well, it's probably your mental illness causing the problem. No, there could be other real issues going on. They tried to blame my UTI once on psychology until I was screaming in an ambulance and I was so dehydrated they couldn't get in an IV. They're like, oh yeah, your bladder, and now it's up in your kidneys, and now it's E. coli. Because they left me on a bedpan so long in a nursing home, but the nursing home was telling me it was all in my head. Then I find out that people with EDS, 90% of the time pop negative for UTIs unless they do the dipstick, do a prolonged dipstick. Fun facts that people need to know and understand. And if they don't understand your condition, how are you supposed to take care of people like us? I'm ranting a bit. So yeah, I'm getting my infusion soon. Before the infusions, I have to get the COVID test. My tilt table test will be October 30th now. I also have to get a COVID test for that. So I'm getting 2 COVID tests that are required before these things, and I have to get 2 COVID tests shoved up my nose in the same month, basically. Literally a month apart. And today started my in-home PT sessions, which that was intense. By intense, I barely did anything and it felt intense. So yeah. Here's to finding new doctors and keep advocating for myself and people, because I'm not going to stop fighting just because I hit a roadblock. Devastated but not broken. Defeated but not broken. No, broken but not defeated. There we go. Yep. Crazy, crazy, crazy. added a doctor this week, got rid of a doctor this week. Peace, love, and Cookie Monster, you guys.